Before I begin, I want to share the story of my friend and how a groundbreaking drug has significantly improved his life. Aloysius has been dealing with severe asthma since childhood. Now, let's start with understanding asthma. Asthma is a chronic inflammatory disorder of the airways that affects over 400 million people worldwide. It is categorized by symptoms like shortness of breath, wheezing, coughing, and chest tightness. These symptoms occur due to the narrowing and swelling of airways, coupled with the production of extra mucus. The causes of asthma usually include exposure to air pollutants, allergens, and obesity. While many people manage their asthma with common treatments like inhalers and steroids, about 10% of asthma sufferers, which is approximately 40 million people, deal with severe asthma. To put this into perspective, this number easily exceeds 5 times the population of Singapore. Global Initiative for Asthma has stated that severe asthma is a subset of difficult to treat asthma that remains uncontrolled with adherence to optimized therapy and treatment to contributory factors such as inhaler techniques. Patients with severe asthma also have worsening of symptoms when a high dose of treatment is decreased. Aloysius is unfortunately one of those 40 million people, and from a young age, he has experienced severe asthma symptoms, and managing his condition has been a constant struggle, which includes frequent visits to the doctors and numerous medications. Common asthma treatments, including inhalers and steroids, were not enough to control his symptoms. For individuals with severe asthma, these standard treatments often fall short, necessitating the use of a more advanced therapies. Biologic drugs have been a significant advancement in the treatment of severe asthma. These biologic drugs function as antibodies, which binds to the antigens on cells, sending different signals to regulate how these cells function. Administered through injections, biologic drugs target specific components of the immune system that play a role in asthma symptoms. Aloysius has tried several biologic drugs, including benralizumab, dupilumab, and mepolizumab. Although these drugs have provided some relief, they have also introduced new challenges. Aloysius often complains that he suffers from side effects such as headache, conjunctivitis, and pain in various parts of the body. These side effects arise because biologic drugs alter the way immune system functions, sometimes causing more harm than good. Now, this brings us to Tezepelumab, which is a new biologic drug, also known as Tezspire, that has significantly improved Aloysius' condition. Tezspire's mechanism of action sets it apart from other biologics. Instead of broadly modulating the immune system, which can affect multiple parts or functions of the immune system, which leads to various side effects. Tezspire, however, targets a specific signaling protein called stromal lymphopoietin, or TSLP. The TSLP plays a crucial role in the release of cytokines, which are signaling molecules that promote inflammation. By blocking TSLP, Tezspire prevents the production of these cytokines, which thereby reducing inflammation and clearing the airways. This targeted approach not only makes Tezspire more effective, but also minimizes side effects, which offers a better safety profile for patients. Tezspire has demonstrated remarkable efficacy in reducing airway inflammation. Clinical trials have shown significant improvement in lung function and a reduction in asthma exacerbations among patients using Tezspire. For Aloysius, this meant that fewer asthma attacks and a greater ability to engage in daily activities without the constant fear of a severe asthma episode. One of the most notable advantages of Tezspire is its reduced adverse effects profile. Unlike other biological drugs, allergens has reported far fewer side effects since starting Tezspire. This is likely because Tezspire's mechanism of action is more targeted, therefore causing less disruption to the overall immune system. For him, this means that there is fewer headaches, less conjunctivitis, and a general improvement in his overall well-being. While it is not a secret that biologic drugs are generally expensive, Tezspire offers a more affordable treatment option at around $2,000 less per year as compared to the next cheapest drug. This cost effectiveness is significant, especially considering the high costs associated with managing severe asthma. For many patients, the financial burden of treatment can be a major concern, and Tezspire's affordability make it accessible to a broader range of individuals. Beyond its efficacy in treating asthma, Tezspire has shown promise in addressing other inflammatory conditions and allergies. This broader applicability makes it a versatile tool in managing various immune-related disorders. For patients with multiple conditions, this means a more comprehensive and streamlined treatment regimen. In conclusion, Tezspire represents a significant advancement in the treatment of asthma. Its targeted mechanism of action, efficacy in reducing inflammation, minimal side effects, and cost effectiveness, and a broader applicability makes it a superior option as compared to the other biologic drugs. For patients like Aloysius, Tezspire offers a chance at a better quality of life and a more manageable treatment regimen. Thank you.